Endometriosis is a very prevalent disease. It's estimated that 10 to 15% of women may have endometriosis during their reproductive ages. And the most important thing that until now it depends on an invasive method for the diagnosis, that is the laparoscopy. If you think about Brazilian numbers, probably more than 7 million women in Brazil may have endometriosis. So this is a huge number of women suffering from a disease that is the most important cause of pain and probably one of the most important of female infertility. So the early diagnosis is very, very important. Early diagnosis starting from a good clinical exam. First of all, we need to hear the women when they tell us their symptoms related to pelvic pain. We need to consider endometriosis for infertile women, and also the non-invasive methods that came in the last years, like the transvaginal ultrasound dedicated to endometriosis, is very important for us to think about the disease and to plan the best treatment for these women. What is very important for us to treat endometriosis is to consider that many of these women, they will want to be pregnant now or in the future. Even for young patients that may have endometriosis, or for older patients, considering that today pregnancies in patients after 30 years old, 35 years old is very common. So the strategy to preserve the organs are very important, considering, for example, the ovaries. There are new alternatives like the use of some lasers for us to improve the treatment and to preserve the ovarian function, to preserve even the deep endometriosis when it compromises the bladder, the bowel. In our experience, 20% of all endometriosis may compromise the bowel. And for us to preserve not only the organ, but the function of the organ is very important. So when we have algorithms that allows us to decide properly when to treat, how to treat, and also when to preserve the function of the bowel, for example, considering the right dissection of the nerves, it's part of the strategy to treat better this important disease.